labor, premature rupture of the membranes. Okay, preterm labor, premature rupture of the membranes. Next slide. Preterm labor. Preterm labor, labor before term. A term, 37 weeks and more. 37 weeks, the completed weeks. The 42 weeks have a term. The humans, الحمل تبعهم 280 days from the first day of the last menstrual period, or 266 days from ovulation. If you do mean, mode, medium, you're talking about 40 weeks from the first day of the last menstrual period. That's how humans function. This is the way they do it. 266 days on average. On average. If they deliver before 37 weeks, calculated from the first day of the last menstrual period, we call it preterm labor. نرجع slide اللي قبله preterm labor. Preterm labor before 37 weeks. It has to be printed in your mind. Preterm labor less than 37 weeks. Okay. Pre-labor rupture of membranes before labor. Preterm rupture of membranes is rupture of membranes before 37 weeks in a woman who is not in labor. It's called PPROM. Not easy to remember, but easy to find hooks تعلق عليهم هاي المعلومات. Why are we talking about preterm labor? Last time we spoke about VTE لأنه it's a killer. Preterm labor can be a killer. Is associated with fetal morbidity and mortality, and is quite common. Is 10% of births are preterm. من كل 10 واحدة بتولد before 37 weeks. Next one. Okay, so now you know what we're talking about. Pregnant women that go into labor before time. Pregnant women that go into labor before 37 weeks. Why does this happen? Same like with venous thromboembolism. I can give you, or you can give me 20 reasons at least. 20 reasons. And when you see them, they quite simple and understandable. History of preterm labor, multiple pregnancy, short interpregnancy interval. الست البادي ماس اندكس تبعها كثير نازل، يعني واحدة very slim, malnourished, vaginal bleeding, polyhydramnios, oligohydramnios, surgery, medical disorders, cervical surgery, I mean uterine cervix surgery, not الرقبة، رقبة الرحم, uterine anomalies, stress, smoking, drugs, infections. Next slide. You see, many reasons. So you should not hesitate to at least recall 10 of them. Now, we're talking about preterm labor. Preterm labor. Labor before 37 weeks. But what is labor? What is labor? Labor is uterine contractions that lead to cervical dilatation and shortening of the cervix. Shortening, that's effacement. The cervix is like the neck of a balloon. As you inflate it, the cervix becomes shorter and wider. Wider, that's dilatation. Shorter, that's effacement. The cervix is normally 3.5 centimeters long. Then it loses the whole of its length, and the uterus becomes continuous with the vagina at full dilatation. So when we say this woman is in labor, she should go into the labor room, غرفة الولادة, not the antenatal ward. إذا عندها contractions with a cervix 2 centimeters or more, will shortening effacement 80% or more. هاي she's in labor, وديها على غرفة الولادة. If you're not sure whether the membranes are ruptured or not, you have to do sterile speculum examination, because if the woman is preterm or she has ruptured membranes, you do not want to introduce infection. لأنه الأمنيوتيك sac is punctured. فالبكتيريا can go up from the introitus, the vagina, cervix, into the amniotic sac and the fetus and placenta, and cause a lot of damage. Next slide. Urine tract infection can cause preterm labor. Screen for group B streptococcus لأنه بيعمل neonatal problems, encephalitis, meningitis, and sepsis. Was not a bad idea to check for sexually transmitted infections such as gonorrhea. But the others, chlamydia and trichomonas, yeah, they can be sexually transmitted, but not candidiasis. Okay, so if you have a woman with contractions, you have to ascertain whether the membranes are ruptured or not. Is there an infection? How likely is she to deliver? How do you know how likely she is to deliver? It's the number of contractions and the status of the cervix, the dilatation and effacement. Next slide. It's not always easy to diagnose ruptured membranes. It is not always easy to diagnose ruptured membranes. It's easy if you put a speculum in, look at the cervix, and the woman coughs or sneezes, and some fluid comes out of the cervix. But this is very, very rare. You see this. So there are other ways. And wherever there are many ways to confirm a diagnosis, it means that none of them is perfect. That's why here we have 5, 4, 3. Nitrogen reaction, that's acid-base test. Ferning, as you can see in the picture, this is dried amniotic fluid, and you see a ferning pattern. زي شجر عصف النخيل. And the oligohydramnios may help. If this, you saw a woman yesterday with normal amount of amniotic fluid, and today she comes and tells you, well, I had a gush of fluid, and you find that her amniotic fluid index is low, then you say, oh, you might be right. Next slide. And an update on 2 other or 3 methods because we don't use them at our hospital. Hence the confusion about the number of tests. Is there an infection? You have to screen for it. Screen for GBS, STIs, urine tract infections. So you take a high vaginal or a cervical swab. You take it. Next slide. This is one of the tests I was going to tell you about. Is the fetal fibronectin. It's of academic interest only because we don't have it. Next slide. It's a glycoprotein. Negative predictive value is high. Positive predictive value not so good. Or not accurate if there is bleeding or intercourse or vaginal examination. Even vaginal ultrasound can affect the level of the fetal fibronectin. As I say, it's of academic interest. We don't have it. Next slide. Cervical length. Of course, this is the neck of the balloon. You know, if it is short, then it's more likely to explode. The balloon, that is. So here you see a functional length and a total length. On ultrasound, if you see funneling, funneling, then that's a bad sign. It is starting to open from the top. See? So if the cervix is short, then that is a predisposing factor for preterm labor. Next slide. So if the cervix is, the functional length is more than 3 centimeters, then that's good, high negative predictive value. If it is less than 15 millimeters, 1.5 centimeters, then that's not very good news. It's likely to go into preterm labor. Between 15 and 29, gray zone. OE, you don't know. You don't know. Okay, so it's good to see that the cervix is long. Next slide. Okay, the question is, اجتك مريضة على الليبر روم emergency جاي لحالها يعني مش على الكلينيك بيقول لك دكتور I'm 32 weeks pregnant ونزل علي مي. You examine her, she has a wet pad, speculum, there is a pool in the posterior fornix. عملت nitrogen test is positive, alkaline. عملت Ferning test positive. Clinically you saw it. She is definite P-prom, not in labor, no contractions. Okay, 32 weeks, definite rupture of membranes, no contractions. What do you do? What do you do? The mother is 32 weeks pregnant. She is 32 years old, 32 weeks pregnant, definite ruptured membranes. What do you do? It's nice to be asked.
Andy, I want to try to prevent any kinds of infection.
Yeah. I was going to say it's good to ask a question when the answer is in front of you. Yes, but I want one of you to elaborate more as to what you do. The woman is 32 years old, 32 weeks pregnant, ruptured membranes, and the What do you do? Is she ready to deliver? No, she's not. She's 32 weeks. Is she likely to deliver? Yes, she is likely to deliver because her membranes are ruptured. So what do you do?
prevent the
ممكن نعطي
delivery.
ريلاكسنتس عشان to delay pregnancy.
Because the lungs are not mature. ها؟
نعم دكتور.
تفضل يا ريت تجاوبنا.
ممكن نعطي uterine muscle relaxants to delay pregnancy وبرضه بنحطها على كورس ل antibiotics عشان GBS.
Yes, correct. عشان الانفكشن in general, not GBX in particular. GBS for all women, any woman. نعمل screening for GBS. I don't want to get confused with GBS. Here we're talking about chorioamnionitis. There is a risk of chorioamnionitis here. So yes, prophylactic antibiotics, erythromycin or penicillin or cephalosporins, yes, and in this order. So yes, antibiotics, there. رأسا antibiotics straight away there.
نعطيش عشان الدكتس ارتريوسس سكر.
No. احنا ما بدنا اياه يسكر. هو lactose. We don't want to give drugs that cause premature closure of lactose arteriosus. Yeah, some of these drugs may have the side effect when we're talking about tocolysis, but we don't want that. So antibiotics غيره. هذا كثير سؤال بنسأل في الأوسكي مشان هيك عم بركز لكم عليه. غيره antibiotics غيره. هي موجود قدامك على سلايد.
Antenatal corticosteroid.
Yes. It's a big must. تعطي steroids to enhance lung maturity. Okay, هلا هذول ما نجادل عليهم. Antibiotics, corticosteroids, dexamethasone, betamethasone, these are the ones we use. So steroids, antibiotics, plus minus tocolysis. Tocolysis, we do not give tocolysis to ruptured membranes. We give it to preterm labor, intact membranes. Why? Because they don't help. Why do you give tocolysis to a woman in preterm labor? To give the steroids a chance to work and to give yourself time to send the patient to a hospital with a neonatal intensive care unit, pediatrics, neonatal, sorry, part of pediatrics. Okay, خلينا عليها بالله هاي السلايد روان. اوكي، انتبهوا لهذا كثير بنسألوا عليه بالامتحانات لأنه an easy question to construct. يجيك بعد 32 weeks pregnant or in labor ولا واحد 32 weeks not in labor but ruptured membranes. What do you do? Ruptured membranes, antibiotics. Not ruptured membranes, no antibiotics. But both will have steroids. Both will be given steroids. Intact membranes, you may consider tocolysis. Intact membranes. Next slide. هاي الستيرويد. Steroids 24 ل 34 weeks بعطي steroid. بعد 34 weeks the lungs hopefully are mature enough with enough surfactant. الواحد ممكن يسأل يا أخي طيب ليش تعطوها؟ Why do you give corticosteroids? Why? To enhance the production of surfactant. So what does that do? Decreases the chance of respiratory distress syndrome. Okay. So you give it the intact ruptured membranes. كله باخذ. Anything less than 34 weeks, you give it. After 34 weeks, it's up to you. Those are the drugs حكيت لك إياهم. If you give it too early, would you consider repeating it? Maybe. ما حدا راح يسألك هذا السؤال. Next one. Tocolysis. تعرف شو معنى tocolysis? Do you know what tocolysis means? Toco is contractions. That's why.
To cease in contractions.
Yes, exactly. To try to abolish contractions. CTG, cardiotocogram, cardiotocogram. This is the like the ECG, CTG, the fetus. Cardiotocogram, tocolysis, same word, tocolysis. Okay, next one. Again, too many agents, and none of them is perfect. Too many agents, none of them is superior, clearly superior to others. But I think probably nifedipine in our setting is probably the best. Is readily available, is taken by mouth, calcium channel blocker, cheap. Terbutaline, beta-2 sympathomimetic, has some side effects. Reportedly, I have used it in the past. It's not all that bad. Indomethacin, this may cause premature closure of the ductus arteriosus. We don't have a lot of experience with it. Magnesium sulfate, the Americans like it. We're not very familiar with it. In cases of preterm labor, we use it for preeclampsia. Next one. GBS هاي applies to all women. حاطه هنا لأنه it does apply to preterm labor as well. But any pregnant woman should be screened for this microorganism at 35, 36 weeks. Because it is associated with neonatal morbidity. Next slide. Universal screening. If you are an obstetrician looking after pregnant women, if you catch any woman between 35 and 37, consider doing GBS. If it's positive, you give her antibiotics when she comes in labor. If she is negative, then you don't. Next one. How do you prevent preterm labor? يعني هذا السؤال ممكن أحط لك إياه في امتحان وأقول لك you have a woman coming to your antenatal clinic, tells you she's pregnant for the third time, and in the last 2 pregnancies, she gave birth at 32 weeks. Twice at 32 weeks. Now she is pregnant 8 weeks. What would you do differently from everybody else? مين بيحب يجاوب؟ عنده very strong history of preterm labor. ولداني مرتين preterm labor. Now she has come to you in early pregnancy. Huh? What can you do?
ممكن نعطيها muscle relaxant عشان ما يصير contraction لليوترس.
توكوليتيك نو ما في أي دراسات تثبت إنه giving زي good idea يعني هذول كلهم tocolytics they have not been shown to be useful in prevention of preterm labor. ويا دوبك يعني they will help you for a day or two just to give the steroids a chance to work, but otherwise they don't help. غيره يا روان.
ما أعرف والله.
Hmm?
ما أعرف.
ممكن نعطيها البروجستيرون فاجينال
Yes,
سبستوري.
yes, progesterone. Yes, progestogens. هيهم two preparations. I think you should give them because there is evidence that they may help. And you either give 17 alpha hydroxyprogesterone caproate intramuscularly once a week. The brand name is Proluton, or vaginal suppositories, Huaku Ora Somni. حبيتها أنا QHS. حطيتها للمزح. مثلا نحكي QRS TDS BD بلا بلا كلها Latin words. لقيت هاي QHS. QHS. What is QHS? Huaku Ora Somni. Yeah, so simple. يعني before going to bed. One suppository before, at bedtime. Somnolence, sleep. Ora, ساعة قبل ساعة النوم. Yes. Interesting. So yes, we give progestogens. أكيد. غيره. يعني, let's improvise. How can we help this woman? Let's make sure she has no infections. Screen her for all infections, vaginal infections. Urine tract infection, رأسا عملنا urine tract studies. Urine, culture, sensitivity, high vaginal swab, low vaginal swab, أي swab بدك إياه. Do it. If she has infections, treat them. Zero. Cervical length. If she has short cervix,
ممكن نعطي
سوري الخط بقطع. تفضل. انقطع صوتك يا معلم. طيب إذا رجع صوتك يا ريت ترجع تحكي. I will appreciate this. بس if the cervix is short, less than 15 centimeters, millimeters, I beg your pardon. Can you imagine a cervix 15 centimeters? No, hopefully it should not be that long. 15 millimeters or less cervical cerclage, cervical suture. Okay, you may consider it. Short cervix, funneling, open os, cerclage. Okay, so I screen for infection. I look at the cervix, consider cervical cerclage, and I put her on progestogens. This is the answer. يعني أنا بتوقع my residents إنهم يجاوبوا هيك يعني. طبعا students يمكن صعوبة أكبر. طيب. And I will give general advice. بقول لها لا تسافري رحلات طويلة، لا تتعبي حالك, take it easy. If you can have break from work, do that. Or I'll do something else for you. I will give you steroids at 26 weeks and at 32 weeks, even if you don't go into labor. راح أعطيك إياهم prophylactically. كويس. أيوه هذا مجتهد الدكتور. شوف بدي يعمل لي 4 شغلات. Oh, I think I'll keep going to him. How do you prevent preterm labor? infections. You treat infections. You see? هذا جزء من الجواب. Next slide. في bacterial vaginosis caused by Gardnerella vaginalis على wet preparation. هاي عينة بتاخذها من الفاجينا. You see a picture like this. Some squamous cells with bacteria latched onto them. Okay, next slide. بدنا نروح على موضوع ثاني هلا. Pre-labor, pre-term rupture. This is pre-labor rupture of membranes. That's rupture of membranes before 37 weeks. إذا حطينا P ثانية بتصير pre-term, pre-labor rupture of membranes. Okay, after 7 weeks, if they rupture their membranes, no contractions, that's pre-labor. Before 37 weeks, that's pre-labor and preterm. Next slide. Diagnosis, history and examination. Ultrasound, okay. Next slide. يا سيدي نرجع على مريضتنا. 32-year-old, 32 weeks pregnant, ruptured membranes. This is Preterm. Classic. What do you do? أول شغلة بدخلها المستشفى. Why do you want to admit her? لأنه I'm worried about choriomyelitis. Choriomyelitis will kill the mother and the baby. Okay. So how do you observe for choriomyelitis? Vital signs, vaginal swabs, clinical examination.